Hi guys, welcome back to the channel. It's another Fab Friday and I've got another Fab patient for you. So let's go straight over.
Hi, my name is Greta. I'm 21 years old and I'm a third year biomedical science student.
Woo! So why don't you tell the guys at home a bit about what brings you in today?
So I've been battling with acne for quite a while now, and that has left me with a substantial amount of scarring, and I'm looking to improve them.
And why don't you tell them which treatments it is that you've tried before?
So 3 years ago I tried the erbium laser.
Any good?
It did bring down my redness, but I'm still looking for improvement, hopefully.
So have you ever tried any chemical peels?
I've tried few, but I've never really seen a substantial improvement from them. It's just more or less they just irritate my skin.
So is it mainly that you're looking to try to see whether or not injectables can give you an improvement in the scarring?
Yes, I'm looking for improvement, hopefully.
When you came in before, we also spoke a bit about lifting, because sometimes if the tissue here is like a little bit heavy, it doesn't really help. So if you lift from here, it can also sometimes stretch the skin out more.
Yeah.
Just for the benefit of the audience at home, you've never tried any sort of injectable treatment before?
No, I've never done anything like that.
Okay, so this is first time. Is there anything that you're particularly concerned about with injectables?
Maybe about the procedure itself. Is it gonna be painful?
Everybody always asks this. This is the $1 million question. So generally, I don't use any topical anesthetic for my treatments. However, if I know that I'm going to be doing a treatment such as this, which is involving an awful lot of punctures to the skin, I generally advise a topical, actually, which is unheard of. I never do that. So, but yes, for you, definitely use a topical. When we spoke about injecting the cheek area to give lift as well, I was thinking as well we could maybe just do like as much lifting as possible, kind of here and here as well. Do you have any objection to maybe putting a small amount in the tip of the chin too?
No, I don't really. It's up to you.
Just do it.
Yeah.
Okay.
Do what you want.
Okay, to stretch it out as much as possible, because I think that will help as well. So in a break from previous tradition, and by tradition I do mean the past 4 videos, I'm going to take the iPad because your main concern was actually the skin texture and skin quality, and you didn't really come in for any kind of injectable treatment. But I was thinking that if we were to add volume in the cheek area here and also at the angle of the jaw there, that will have a lifting effect. And in my experience, it can sometimes make a difference to how the texture of the skin looks. So obviously we're going to do some very small injections directly into the scars themselves, and also using a bit of subcision as well with a cannula. So there could be a bit of bruising afterwards, but that's normal. But the more that we can pull up and stretch, the better. Also worth doing, I think, is the tip of the chin as well, just to bring that down into a bit of a point, and the horizontal chin crease. Was there anything else that you were kind of thinking? Maybe even the temple we could do, because that's just a little bit hollow, and again it will just help to give a bit more lift here. You happy with that?
Yeah.
Okay. It's just like do whatever you want. So I don't think there are any better words in the English language than that. So let's go and do it. So first up, some Juvederm Vol-Lite to the scarring on the cheeks. And I've put here 1 ml per side. I've then gone back in with some Profilo to do 1 ml per side. And with both of these products, I am trying to cause some subcision with a needle, basically breaking up that scar tissue as much as I can. Now switching to TSL Ultra Deep. Using a needle along the cheekbone, using 1 ml per side to get some lift. Going back in with Ultra Deep, using a cannula, we're doing 1 ml per side. This is overlaying the work previously done with a needle, because it does give you a slightly nicer curve. In total so far then, we've done 4 mils of skin improving filler and 4 mils of volumizing filler. Now using Juvederm Ultra 4, 0.5 mils per side in the temples, and then Ultra 4, 0.5 mils per side in the cheek. Switching to Voluma with a cannula. We're using the product in the marionette line, the chin crease, and also down to the point of the chin, really using the product in a fan shape. And we're going to go for 1 mil per side. This is going to take us to 8 mils in total of volumizing filler and 4 mils of skin improving filler. Juvederm Ultra 4 now to the point of the chin, and Ultra 4 again with a cannula to the cheek. This brings us to a total of 11 mils of filler for volumizing and 4 for skin improvement. Okay, so here we are back again. So how did it go?
It went pretty good.
Yeah?
Actually better than I expected. I didn't really know what to expect while going into this.
Yeah.
And the experience was actually really nice.
What was the best bit, you think?
I think the best bit is like that you actually get to see the progress.
Mm-hmm.
Because usually if I get something done for my scarring, the swelling just goes away and it's back to what it used to be.
Yeah.
And it's really good to actually like see a change.
Okay. Oh, so for you, that was like the best part of the treatment.
Yeah.
Because that's quite interesting. Because in terms of like how much we did in different areas, we did more sort of lifting work and not a huge amount of stuff for the scarring. But for you, that was the most important bit.
Yes.
Oh, that's interesting. So did you get any bruising?
Yeah. Obviously, I was expecting that. So I've got a lot of yellowish bruising on my cheeks. Mm-hmm. So it wasn't big of a problem because it's like yellowish. So it's like the color of your skin basically. Mm-hmm. And I only had like one little bruise underneath my lip, mm-hmm. just where the incision went with a needle, mm-hmm. basically. But it went away so quickly. Mm-hmm. Like in just a few days. It wasn't really a problem at all.
Did you get a lot of swelling as well here?
I was really swollen, yeah. For like at least 3 days, like really swollen. But again, it went really quickly.
Yeah.
It's like in 5 days, I was good to go.
Yeah. Oh, that's good. That's good. We spoke off camera a little bit how I think there's been a really nice improvement in the scarring. So we did talk about maybe doing it again at some point. Yes. So I'm looking forward to doing that so we can show you guys a bit more progress. But I think it went really well. Is there anything like else that you would do, or like this is still your main focus?
I think I definitely like what's going on here, the shape of my face. I didn't really think that it would suit me because I wasn't really thinking about these kinds of changes. Yeah. But when I got them, I really do like them. Like it changes so much, and I really like what I'm seeing. Cool. So yeah.
Did anybody else notice, or was it just more for you?
Yes, people did notice that I did something, but one person guessed that I gained some weight. That's not too bad, but yeah. But I don't mind. Yeah. It's okay with me.
Because it's not for you, for them anyway. You're doing it for yourself.
Yeah, it's fine. Like I'm not after like looking natural.
Yeah. It's like... Cool. So I guess we'll see you on the channel at some point in the near future. Okay guys, so that's all we've got time for this week. I hope you really enjoyed the episode. Join me again back here in 2 weeks time where I'll be bringing another patient in then. I will see you guys then. See you later.